Hello guys, once again welcome to Medical Philly. Today I am back with the Fmge pharmacology questions. So, first question is, a lady was stung by many bees. She was developed breathing difficulty and hypotension. It is an acute anaphylactic shock in which more number of histamines release into the bloodstream, which causes the bronchoconstriction and hypotension. It is an immediate type of hypersensitivity reaction. Adrenaline is given in this type of patient, which causes the bronchodilation. And the next question is dopamine at low dose. Actually, the dopamine action is different at different doses. It works on D1, beta 1 and alpha 1 receptors. Like less than 2 microgram per kg, it works on it increases the urine output, and 2.5 dose it increases the cardiac output, and 5 to 10 dose it increases the blood vessels. So it increases the renal blood flow in this case. And here given a case, a patient presented with weakness of limb muscle, especially in the after evening work. The symptoms improved after hydrophonium test. As I told in the previous video, hydrophonium test is done for diagnosis of myasthenia gravis. After the administration, which shows increased muscle weakness and eye movements. So different doses given for the test until the response from the patient. And this is the same question from the previous one. So the answer is hydrophonium. And the next question, after eating an unknown plant, the child was presented to the emergency with chamatostatus, pupil dilated and skin dry, body temperature raised. So this is due to datura poisoning. It causes the dry skins. Next, a farmer is presented to emergency with garlic odor, breathing pinpoint, pupil and excessive salivary secretion. This is a organophosphate poisoning in which atropine is given. And this is a direct question. In Alzheimer's disease, acetylcholine is a deficient. We have different types of drugs we can use to manage these Alzheimer's diseases. We have rivaroxaban, tachycardia. And here a patient presented to hospital with a road traffic accident. The patient has raised ICP, intracranial pressure, without hematoma. So we can give, to decrease the ICP, we have to use osmotic agents like a mannitol. It is also used in the traumatic brain injury, subarachnoid hemorrhage, acute liver failure, etc. And this is also a direct question. In Parkinson disease, we know that the neurotransmitter reduced is dopamine, and acetylcholine increases in this condition. Hence, the patient is characterized by resting tremors and also hypokinesia. So in this case, a pregnant lady with a previous child with a Down syndrome currently on lithium therapy. It means she was taking treatment with antidepressants. So during a pregnancy, it may cause the abstain abnormally as mentioned in the following. And the next question is, antidepressant act by inhibiting reuptake of both serotonin and norepinephrine. That is vanilla of action. Reuptake both serotonin and norepinephrine, as I mentioned below. Just see it. And here a patient was given halothane for general anesthesia. He developed a muscle rigidity and hypothermia. In patient who receiving halothane or succinylcholine for the anesthesia, and especially the patient who having abnormality in the ryanodine receptor, so that more number of calciums or getting into muscle, that causes the more contraction, which causes the hyperthermia. So here dantrolene is the drug of choice for this patient. And in this case, all are bronchodilators except hydrocortisone, which is an anti-inflammatory. Salbutamol, the alpha beta blockers. The next question is drug of choice for digoxin induced ventricular tachycardia. It is also called as lidocaine or lidocaine is given. And radioactive iodine useful in treatment of thyroid cancer is I-131, which has a lifespan 8 days. Vitamin D and a parathyroid hormone and calcitonin
are the substances, hormones that involved in regulation of calcium balance in the body.
So in the next question, the longest acting PDE5 inhibitors, which are usually in the treatment of erectile dysfunction, which is tadalafil, has the 36 hours of duration. And this is a very famous question about gout, and the answer is xanthan oxidase, and allopurinol is the drug of choice for this. So ofloxacin is contraindicated with a patient of seizure disorders. And the last, a patient traveled Assam. After coming back, he developed fever, chills, and altered sensorium. It means a cerebral malaria. For this situation, the treatment of choice of the patient is it should be etrisonate as the IV. Thanks for watching. Subscribe to Medical Philly. Stay tuned. Thank you.